today I want us to talk about a condition called pyelonephritis. So, pyelonephritis is a condition that affects the kidney. So, it is also a condition that occurs as a complication of bladder infection. And why am I talking about this particular condition? It's because it mostly affects the female more than the male. And you see, bacteria are normal floras in the body. Example like bacteria that lives in the GIT. If they leave the GIT, then find themselves in the urinary tract, it can cause infection. And infection that enters from the anus when you don't wash up yourself well, when you don't clean up yourself well, like after going to the toilet, most of us use water to wash up, some use toilet tissue to clean up, which is okay. But the problem I have here is, how do you do it? Do you push bacteria from your anus to your vagina? Or do you push this particular bacteria that is going out from your urinating parts back to your body? If you wash it, first of all, wash out before in. Do you understand? Like, do not push the bacteria backward again because you already pin it out. If you do that, it will go back to the ureter, then from the ureter to the bladder, causing bladder inflammation to the ureter, then causes infection to the kidney. You get, so women are more at risk, like I said earlier, than men for kidney infections because the ureter is shorter than it is in men. So this makes it easier for bacteria to reach the urinary tract, and the ureter in women is closer to the vagina and the anus. Some of us don't even wash our panties immediately we finish bathing, which is really wrong. If you finish bathing, wash your panties. Do not keep it till whenever, till the next time you want to bath or till the next time you want to wear it. Wash it, spread it outside, let the sun touch it before you wear it again. Another thing again is, yesterday we posted in the female surgical ward. So there's a case I saw that really got to me. So I started asking questions. I had to go pick up this woman's folder. I read about this condition, and the condition is called ascites. Ascites is inflammation of accumulation of a fluid in the body, which leads to swelling of the stomach. So I saw this woman having accumulation of a fluid already in her stomach, and she has been in the hospital for more than 6 months. And I overheard the doctor saying they should discharge the woman, and it's not something I will let go. I started asking the matron why. The matron was like, when I read about it, didn't I see that this woman has been in the hospital for more than 6 months? That her case is no longer a case that they will keep in the hospital. She's already taking drugs, which she can take at home, and she's complaining of not having money to pay for the hospital again, that they need to discharge her. She can go home and be taking the drugs. So I told the woman that when I was reading about this particular condition, that I saw a lot that this woman needs to be health educated on, that she don't need to start taking a lot of salt again. In fact, if she can do away without salty things or salty food, it will do her better. Then continue with the drugs they give her, like fluxamide and all that. So the matron was like, oh, it's fine, it's okay. But the thing is, will she hear? They know that patients you talk to and they do what they want to do. Do you understand? So I was like, ma, please, can you permit me to go health educate this woman? So I went to this woman. I started talking to her. Initially, I wanted to check her blood pressure. And you see, she's really shrinked. The hand are tiny. And there's something she said to me that got to me. She was like, because the blood pressure machine that was using keep showing error. She was like, my sister, see, I have tiny hands, and that is why you cannot see anything again. I felt it. I felt this particular word, and it really got to me. And I said to her, no, it's not because of that. It's just normal. It happens to any other person. You see, the woman is already confused. She's already talking anyhow. She just want to leave. Do you get? So I sent her to educating this woman. I started telling her, don't eat salt. Don't, if you can do away without salt in your food. It happened that when talking to this woman, did not even know that there are a lot of things she can do. She started saying, really?